These are exactly those cases of patients whom we think need a blepharoplasty. In reality, blepharoplasty is not the surgery that should be performed. And to help you understand what these cases are, I brought here a photo of a celebrity who perfectly exemplifies exactly what I mean. A young, beautiful woman who, in the first photo, clearly looks like she would need an upper blepharoplasty. She has that little fold of skin and would seem to need this procedure. But if we stop to, evaluate, to take a closer look at her photo, we'll notice that what really stands out isn't the excess skin on the eyelid, but rather the drooping of the eyebrow. This is the typical patient who, if we only perform the blepharoplasty, will end up with a slightly longer scar, but that won't make her look any younger or more beautiful. You're simply going to remove a bit of excess skin, and you can see in the post-operative photo that she did her homework well. Actually, her plastic surgeon did his homework well, and she had a brow lift. And that was exactly what she needed. And why is that? Because when we perform eyelid surgery on a patient whose brow is drooping, we end up removing too much skin, the scar gets poorly positioned, and then when we go to lift the brow, the patient can end up with lagophthalmos, which are those complications we often see. This one is from a real patient. Clearly, this is a patient who underwent blepharoplasty when she shouldn't have. She should have had her brow lifted. The scar ended up in a poor position, extremely high, and when we put the brow back in place, the eye stays a bit open. Before you think about having eyelid surgery, you're going to do a very simple test at home. You will lift your eyebrow and put it in its proper place. If even after putting your eyebrow in place, you still have excess skin on your eyelid, then that's your indication for surgery. Every time you try to do a blepharoplasty without correcting the position of the eyebrow, you end up removing too much skin and you get this kind of stigma. And when we restore the anatomy to its proper place, the patient is left with a poorly positioned scar.